As we begin, just a couple rules. This forum is being recorded and streamed to Facebook and YouTube, so you are more than welcome to choose to have your camera on or off. The forum will live on our YouTube and Facebook channels after, so you can share it. If you have to leave, if you miss anything, you can come back and watch. All participants should be muted upon entry. I'm hoping Chloe can double check that. To ask a question, type your question in the chat box, or you can use the raise hand function under reactions in the bottom of your screen. We have Chloe who is monitoring the raised hands, and we will try and get to everybody. Appreciate people not jumping into conversation so we can make sure that everybody is respected and heard. Okay. A moderator will call on you and unmute your microphone so you can ask your question. Or if you'd prefer us to ask it for you, again, you can put it in the chat. Use the chat for comments. If you require a screen reader, which I know there's some people here today that are using screen readers, we do recommend that you close the chat. We will be sending out a complete transcript of the chat after the event next week to all attendees, as well as the actual transcript of the discussion today. We have automated closed captioning available, so please go to the button of on the bottom of the Zoom meeting and click live transcript and show subtitles to turn them on. Our agenda for today, short welcome. We're going to have panelist introductions. We're going to have just under 2 hours of discussion, which I promise you flies by. And then we'll do our closing summaries. So to begin, I'm just going to show a short video on some of our other programming offered by ConnecTra.
ConnecTra creates opportunities for people with disabilities by providing information, resources, and programming geared towards greater inclusion and quality of life. On Service Mondays, we highlight a local organization or initiative. On November 6th, it's Mashup Labs, and November 27th, it's Wavefront Community Center. Every third Monday is our Perspective series, where you'll hear from guest speakers on varying topics. Join us on November 20th to tune in to a discussion about navigating winter sports with a disability. Wednesdays are Chair Yoga with Bobby Seale-Kavitsky. Thursdays are Adaptive Fitness with Ocean Rehab and Fitness. Fridays are Contemporary Improv Dance classes with Janice Lawrence. Every third Friday is a growable presentation by the Disabled Independent Gardening Association. This month, we're learning about anti-inflammatory foods with Renee Chan. We have a new program starting this December, Creative Writing. Classes will be online Tuesdays at 4 p.m. PT. Join us for a ConnecTra holiday party at the Roundhouse Community Arts and Recreation Center on December 6th. Visit the events calendar on ConnecTra's website, connectra.org, for more information and to register for events, or find us on Facebook.
All right. Okay, and now we are going to introduce our panelists. If I can get to the next slide, which I don't seem to be able to. All right, so I'm going to introduce our panelists briefly, and then I will let them introduce themselves. That works. So today's panel consists of Charmaine Niebergall, the engagement leader on the patient and public engagement team at Health Quality BC. Joanne Smith, a certified nutrition practitioner at Fruitful Elements Nutrition. Her specific area of focus and expertise in nutrition is with individuals who have sustained traumatic spinal cord injuries and brain injuries. Cassie Stark, who is an occupational therapist with Tall Tree Integrated Health based in Victoria, BC. Her main areas of practice include concussion and mental health. Pascal Gendral, I'm hoping I said that okay, is a program staff at Pathways Clubhouse, working in the public education department. And Heather Lamb, who is the Infoline Services lead at Spinal Cord Injury BC. Heather is visually impaired and handles calls with clients needing assistance over the long term or who are dealing with multiple issues related to employment, housing, or health. So welcome, panelists. Anything to add to your bios? Maybe you could just say hello so that everybody knows who you are.
Hello, I'm Charmaine.
Awesome. Okay, great.
Hi,
All
I'm
right.
Heather.
There's Heather. Thank
Hi,
you.
my name's Vanessa. I'm actually Cassie. It wasn't able to make it today, but I'm another community occupational therapist from Tall Tree Health. So I'll be stepping in today to represent Tall Tree.
Oh, thank you so much for joining, Vanessa. Sorry, I didn't let you in earlier in the meeting. I didn't hear anything.
No, that's okay. That's totally fine. Thank you.
Welcome.
And hi, everybody. I'm Joanne. I'm calling in from Toronto. And I'm very thrilled to be a part of this discussion today. And I have to say, I'm always impressed with what is happening out in BC. I'm pretty connected with SCI BC. And, you know, their organization is very advanced, I think, in terms of services they provide. And even just watching that video right now, Emily, phenomenal. We don't have anything like that out here in Ontario. So this is just, I will learn a lot today from all of you. So thank you for letting me be a part of this.
Thank you so much, Joanne. Thanks for being here. Okay, so to start, I would love for each of the panelists to just define what accessible healthcare means to you. Maybe we can start with Joanne.
Sure. So I think it's like universal design. It's a basic human right for all of us to have equal access to services, hence universal design. And it's also a basic human right to have access to accessible healthcare. And if we're denied that, it's a violation of human rights. And it's just, you know, everybody from visual impairment, hearing impairment, mobility impairment, everybody should have equal access to information, services provided, communications, you know, to accessibility when you actually get to a healthcare facility. I have a mobility impairment, so that includes everything from, you know, high, low tables to help get you on to have examinations. And it really is just across the board, complete and utter accessibility. Before I became a nutritionist, specifically looking and working with people with neurological conditions, I was actually a reporter and a producer and hosted 2 national television shows in Canada on disability issues. And what I find frustrating, and I think it's wonderful you're hosting this today, is because when I did stories for CBC 25 years ago on exactly this issue, we're still dealing with accessibility issues in healthcare today. So, you know, we need to still obviously raise awareness about accessible healthcare. And it's just, you know, it's disappointing and disheartening that here we are 25 years later, still dealing with the same issues that I covered years ago on television. So
I agree. And I think there will be lots of gaps to be discussed in this conversation, and hopefully a lot of solutions mentioned as well. Heather, do you want to go next?
Sure. I'd like to agree with everything that Joanne said. I would add that when the general public talks about accessible healthcare, they mean that they can get the healthcare that they need. But for disabled people, obviously, there's other accessibility considerations. And those include accessibility of the offices, the accessible exam tables, but also knowledge from the practitioners about the person's specific disability. We certainly don't expect every family doctor to know every single disability diagnosis. That's not realistic, but I think it's realistic to expect that we are referred to somebody who does know more about that particular condition, and we shouldn't have to wait for years to get referrals to specialists.
Absolutely. Great points across the board. No, Kathy is not here. Vanessa, was it?
Yes, it's me.
Thank you, Vanessa.
Thank you, Joanne and Heather. You guys really like hit the nail on the head there. Yeah, for me, when I think about accessibility in healthcare, it's making sure that everyone has accessible access to the healthcare that they need in a timely manner, irrespective of any of their circumstances or personal characteristics. So that, like, aside from the physical aspects of things, but it's also the socioeconomic factors, their gender, sexuality, the way their communication preferences, those are really important as well to be considered. And I sometimes find that those sometimes do fall short within the healthcare system. Particularly in my work in the private sector, we oftentimes are advocating and having to bring up these situate or factors to adjusters and funders because they're not aware of it. So I'm really glad that these conversations are occurring so we can have open discussions about it and I can learn about different perspectives outside of my own.
Awesome. Yes, this is going to be a learning experience for all of us. And that's why they're always really important to feel heard by the community as well. Charmaine, would you like to go next?
Absolutely. Thanks so much. Thanks so much, Joanne, Heather, and Vanessa for that. I'm going to take just a quick moment to add a bit of introduction to myself, calling in from traditional unceded territories of Songhees and Esquimalt nations, colonially known as Victoria. And I work for Health Quality BC, and through Health Quality BC, I also especially work a platform that we have called Patient Voices Network. So I will speak to that more as we go forward. And before I was at Health Quality BC, I worked for Island Health, and I mostly ran the acute volunteer programs in like the hospitals. So very much kind of like a focused in community as far as being at Island Health. And before that, I worked for the MS Society of Canada. If you hear background noise or see anything, it is my very chatty coworker. My cat is that person because I do work remotely from home. And this is not, if you're seeing my background that has very pretty fall vibes, that's not my actual home. This is just a Zoom background. I really appreciate us asking this question about accessibility. I think it has a lot of different interpretations and means different things to different people. I think that our personal experiences often are the ways that we have these definitions. So for me, having friends and family with both visible and invisible disabilities, it means that they have appropriate quality access to healthcare that meets their needs. And it's something that I especially witness with a parent with a disability, several different disabilities all the time, daily, and see a healthcare system that does not always meet their needs. So that's something that's very important to me to see that. Around learning, I just want to quickly touch on always learning. Just the conversation I've seen a little bit in the chat this afternoon around for some folks the real importance of having an ASL interpreter. I really appreciate hearing that kind of conversation and different angles and views for folks. So thank you for that as well.
Yeah, absolutely. We are seeing what is happening in the chat here, and so I do appreciate Scott, your comment, and Binu. I do apologize for us not having an ASL interpreter here at this meeting today. That's not something we have done with our online forums in the past, and this is the first that I've heard that would be very helpful outside of our closed captioning. So we will definitely put that into our future plans. And again, I apologize and appreciate the feedback. It is important that this is a consistent learning process, and that's why we have conversations like these. So thank you. Pascal, do you want to talk about what accessible healthcare means to you?
Hi, thank you. I think others have kind of covered the majority of it so far, but I'm coming from the lens of working alongside people with mental health concerns. So a lot of the resources we're trying to access are those mental health professionals. And yeah, it's definitely not accessible. And what is available is very short term or really long wait lists. And the options that are available just aren't, I feel like sometimes they're doing more harm than support for a lot of the people that come to Pathways Clubhouse. Just for instance, when someone is in a crisis, you know, there's the crisis line or there's the hospital, and those are the options. And given some of the backgrounds that people have, they've had traumatic experiences. And so having that be their resource or what's accessible to them for their health just really isn't a good option. So I think from the work that we do here at the Clubhouse, being able to access more mental health resources that are long-term and specialized and can really meet the needs of the people here would be amazing. So, and not just to the community at the Clubhouse, all Canadians. So that would be ideal.
Absolutely. And if you have any resources that you know of, this goes to everybody, panelists and attendees, and want to share them in the chat, again, we will have a transcript going out after this meeting next week of everything that was mentioned. We'll also add the resources to our ConnecTra website. So hopefully we can leave here with more resources than we knew of before, and yeah, be sort of moving in the right direction. Speaking to what Pascal said, I want to go to some of our findings from the survey that we launched at the beginning of this month. So 81% of our survey respondents agree that ableism is an issue in the healthcare industry. 63% of respondents say people with disabilities do not receive the same level of care as people without disabilities. 51% of respondents say that medical professionals have made them feel like a burden for seeking care with their disability. Can we talk about, maybe we can go to Charmaine first, how are healthcare providers being held accountable for discrimination? And where do you go if you feel like you've been discriminated against in the medical system?
Yeah, I mean, I can't speak to it specifically around discrimination, but around absolutely the accountability piece. I mean, first of all, HQBC, just so that you know about the work that we do, and I'll throw our website into the chat so that folks can see what on earth I'm talking about when I say HQBC, which stands for Health Quality BC. We are leaders in the health system and provide guidance to the Ministry of Health. It's a relationship. They fund us, but we also give them guidance on projects and provide leadership, especially around quality. A big part of, like I said, the work that we do is to the Patient Voices Network, which I can speak to later, but that's also around that accountability in regards to involving what we call persons with lived and living experience, which is all of us. We've all experienced access to healthcare, either ourselves or through friends and family. And by having that Patient Voices Network, we bring in those voices to improvement projects in healthcare. So that's one way that we do work around having that accountability, especially around improvement. Now, when it comes to the pieces, and I'll have some other links I'm going to put into the chat here, when it comes to pieces around concerns you have around access, any concerns, honestly, the main way that we usually recommend folks go is through what's called PCQO, or Patient Care Quality Office. Some of you might be familiar with that. So every single health authority is required to have a patient care quality office, and they are legally required to follow up on every single complaint that comes through. Patient care quality offices also accept compliments. So that's another thing. If you do experience really great care, that's another way that you can also shine a light on that. But that's where you can formally lodge complaints that are legally required to be followed up through the system. And it's, like I said, health authority based. So depending on what region you're in, it would be, you'd find the office at that link. The other way that you can also, and I don't love the word complaints, but the other way that you can also lodge complaints, and I'm putting the link in here as well in the chat, is directly to the Ministry of Health. So I've put that link in there. And at that link, it also shows you all the different kind of areas of health that you might be trying to identify a concern. And then the last one I wanted to share was also the BC Ombudsperson, so their website as well. I'm just going to put that in the chat as well. So those are all different areas, avenues as far as lodging complaints and concerns. I'm also just going to share this one. This is only one of many, but there are a lot of advocacy groups as well who do wonderful work. And a lot of the times, this one is BC Healthy Living. And there's lots of advocacy groups who really work side by side with the health system to really push change around policy and procedures. So that's just an example of one. And like I said, there's also the Patient Voices Network, who which is a lot of the work that I do, where we bring, again, side by side, bringing our patient partners together with healthcare partners to work on improvements. Someone else on the panel here can maybe speak to other ways. Like, I believe there is, you can reach out specifically to different colleges Vanessa nodding your head yes. I'm not sure if someone else wants to speak to that.
So I can touch on just for occupational therapists and for other allied health professionals. So each of our professions has a governing college or body that this is where we usually apply for our licenses, and within those governing bodies as well. As a client, you can also file any complaints, or if there's any discrimination that you're facing, you can actually file complaints directly to the governing college. Each province will have their own governing body for their profession. So for example, we have a college for occupational therapists in British Columbia, but there will be an equivalent for Ontario, Alberta, and any of the other provinces. So if you do need to make a complaint about a specific clinician under those governing bodies, you can always just go on websites and find links for those specific colleges, and then they'll be able to lodge a formal complaint there.
Okay, wonderful. We had a comment in the chat. Jess had a question. Is there a time limit for submitting a report? I think this is kind of more to Charmaine about the reporting.
I don't know that I can speak enough to the reporting. That would be something because I don't work for the Ministry of Health. I'm not too sure how that works, and I don't work with our systems analytics closely. At HQBC, we do have folks that work on that, but I don't know that I can speak to how that works from the data set standpoint.
Okay, does anyone else on the panel want to speak to this issue, how healthcare providers are being accountable for discrimination?
I can jump in here. I'd actually like to take a step back and acknowledge that there is a lot of ableism in the system, which is not surprising given that our society also has a lot of ableism. One of the best ways that I think we can counter the ableism in the system is to better educate the next generation of doctors, nurses, and all other medical professionals. And part of that involves going into the schools and making sure that they have a full understanding of disability before they graduate. One prime example, I often speak to classes at the University of Northern BC in Prince George, where I live. And a couple of years ago, we were speaking to a health sciences class. It was a fourth-year class, and these are students that are going on to, they're in nursing or they're going on to medical school or occupational therapy, those types of things. And one of the students commented that it was the first discussion of disability that he had heard in 4 years of school. That's concerning. So I think as a community, we need to be stepping up and doing as much as we possibly can to make sure that our voices are heard in the education system in hopes that we can reduce the number of people who have to put in complaints down the road.
Prevention, yes, absolutely. I think that's a great point, Heather. Pascal or Joanne, do you want to jump in on this at all, or should we move on to the next question?
I'll just go off of what Heather said in terms of the education side of things. That's primarily my role here at the clubhouse, is going into the community and connecting with people and just trying to reduce stigma around mental health and what different diagnoses might look like. We also have sub-programs where we have staff that are of a younger age that go into the high schools with other members living with a mental illness to have those open conversations and talk about what mental health, mental illness looks like, and create a space where they can ask questions, gain information, and also just come into the clubhouse space here and learn a little bit more about what that looks like. So I definitely agree. Starting younger and providing the information and access to people who can openly have those conversations is a great starting point.
Yeah, this was an overwhelming response in our survey of ways that ableism can be mitigated in the healthcare system. The number one response was education for healthcare staff. So I would be interested to hear for the healthcare professionals on the panel. Can you speak of the training that you did receive around disability and ableism in your professional practice and some of the gaps that were maybe missing? Maybe we could start with Joanne on that.
Sure. I also just want to reinforce what Heather said too. Education to physicians is absolute key. It's shocking how many physicians, when you roll into their offices or their examination rooms, you can see the discomfort, that they're just not a lot of experience, interaction with people with disabilities. And again, the stories we did 25 years ago, it's often assumed because you have a disability, you're sick. And it's trying to, really divide that as well. As I'm living with a disability can be very healthy, but they seem to always assume you're sick. And then you have to, clarify and advocate for yourself why you're there. And so education for physicians, absolutely. For me, in terms of my education, I was kind of the first person with a disability going into nutrition school to specialize in people with neurological conditions. I knew I was taking a huge risk at doing this. When I was injured 35 years ago, I wanted to get into the healthcare profession before I was actually injured. And then when I was injured at 19, I realized healthcare and disability 35 years ago didn't mix. There was no way I could get into the industry and be accepted. So I actually had a different career. And then with more awareness came back to then going back to school to work in this field, knowing there was more acceptance at that point because of the awareness. So I really had to advocate for myself and push. This is what I wanted to do. I knew it was a missing piece in the kind of holistic approach to recovery and long-term health for people with neurological injuries. And that's what I based my business on, my nutrition field. And so there has been great acceptance with it. That being said, ableism on the flip side of being a healthcare provider, I work with anybody. I specialize in neurological conditions, but when I have able-bodied people who see me on Zoom or talk to me on the phone, have no clue I have a disability, they roll in. And when they see me in clinic in a wheelchair, some of them have walked right back out. Like, it's quite shocking. So there is awareness that has to go on with physicians, healthcare, but also just, the society at whole. So there ableism on both sides. But when it comes to my own healthcare, or it comes to practicing as a healthcare provider, advocacy, you have to remain calm and advocate for yourself. It's just part and parcel of, unfortunately, the way our system is still functioning. And so no matter what environment I go into, whether it's my own healthcare or working with any kind of, clients, it's knowing the back of my mind, I'm going to have to do a lot more education here to lay the groundwork and make people comfortable. And that's just, it's part of my acceptance in what I do and what I have to put out there in order to be taken seriously as part of a healthcare provider in this field.
That's fantastic work that you're doing. Charmaine, you have your hand up.
Yeah, thanks for that, Joanne. That's super interesting to hear and good to hear. I just wanted to share around the education piece for healthcare providers. I am seeing in recent years a change towards a more patient and family-centered approach in the teaching. And I know about this because schools like UBC Medical School, as well as the medical imaging programs here on Vancouver Island, like at Camosun, BCIT, and I know there's others, they make a very conscious effort to bring in what we would call the, patient voices and patient partners and caregivers. Now, they're not specifically always looking for folks who have disabilities, but being able to bring in those voices hopefully can give that kind of patient-centered lens that often will include those experiences of accessibility. And also, I'll add that there's the ideology of what we call what matters to you, or the framework called What Matters to You, which I can also add that in the chat, just realizing I could do that. It's a framework that HQBC, PVN provide education to the system about, and we do know that that's happening in a lot of the schools. And it's this reframing of making both the education, but also the healthcare practices to be focused on what matters to the client. So what matters to that person in that moment and under their context and story. I just put in that link in the chat, just more about the What Matters to You framework that's also being taught. And I just wanted to add that.
Thank you for that. That's great. Does anyone else want to talk to the educational training that they received or think should be implemented, more ways to advocate for that on the
I can
panel?
speak about that. So I went through my social work education and there was one class on disability issues. It was an optional class. I chose to focus most of my projects in other classes around questions of disability. And I had a couple of profs inform me that they were actually learning from me during that process. I also did a practicum in hospital social work, and I had some pushback from, not from social workers, but from other medical professionals about whether or not I belonged in that space as a low vision person. I proved that I did belong, obviously, but it was shocking to me at the time. So I did some research about it, read some literature, and discovered not what I shouldn't have been surprised that ableism is so common in the medical field, but at that time I was younger and a little bit more naive, and I was surprised, which is why I say we need to improve the education that people are receiving so that it's no longer surprising to other professionals to have a disabled colleague.
Very well said. I'm glad that you could be of educational value to some people that you were with at that time. We did have Leslie Scott in the chat say, my concern relating to hearing loss, whether captioning or ASL interpreting for extended health services, including dental, eye care, physical therapy, massage, nutritionists, etc., outside of the hospital setting. These services are not included in access and requests to the service providers to pay for, and it's often denied. This also came in from our 66% of our survey respondents don't believe that the provincial government / government of Canada provides suitable assistance for people with disabilities to access healthcare services. And 51% of respondents don't know which healthcare services in BC are free and which have partial costs. So there are some obvious gaps here. I know also in the mental health space of things not being covered. Heather, I feel like I would go to you first on this about maybe speaking to some partially covered services and what this looks like.
Sure, this is a challenging one because our system is very patchwork. We are told from a young age that we have universal health care. That's actually not really the case. We have universal access to certain parts of our healthcare system, but not all of them. So there's things that are covered for some people, such as home support for people who are on PWD, Provincial Disability Assistance, or other very low incomes. But for people who are kind of on that line between having just enough money to not be covered, but not actually having enough money to pay for the service, that's where it becomes quite problematic with accessing home support, or catheters are a big one. They're not covered in our system except for people on PWD. So people are literally paying to urinate, and that's a real problem. There's a lot of things that are like that in our system. So if people aren't sure what's covered or what isn't covered, that's actually one of the services that my organization provides. We have information about who is covered for which things. If you're not sure, give us a call and we can help you navigate through what you might be eligible for. And I'll put that information in the chat.
I was going to say, maybe we could post that information in the chat. That's fantastic. Does anyone else on the panel want to jump in on that? Things outside of the regular scope, like nutrition, counseling, mental health, not being covered. I do see a hand up from an audience member. Amelia?
Yeah, I was just wondering if we are going to have a participant discussion as well, or if it's just the panel speaking today.
Yeah.
Because I think it might be helpful to hear feedback from what people with disabilities, like in the participants have experienced as well.
Yeah, I agree. I agree.
Absolutely. Yes, this is why we have the raise hand function for sure. If you have something to share, we'd love to hear from you. This is also why we send out the survey in advance so that we can get feedback from our community, and why we all want you to be here. So Amelia, if you want to start off, I just do ask that everyone, if you're not speaking, to continue to keep yourself muted so that we can give the speaker the floor. Did you want to share something in particular, Amelia?
Yeah, I was just thinking too that we need funding for things that prevent health problems as well, such as housekeeping stuff. There is no funding for that, to have my house cleaned so that I don't become sick from air quality issues and germs and stuff. And I have a difficult time cleaning the house by myself due to being in a wheelchair and being a little person and such. I have brittle bones disease. And someone mentioned earlier about seeing physicians that specialize in a person's disability. However, I find in BC, there's no doctors that specialize in OI. Like, even most of Canada doesn't even have OI specialists. And I think a lot of people with disabilities have a hard time finding doctors that specialize in certain disabilities. So they have to just go with whatever they can get, right? Whatever the government provides them with. Yeah, I find a lot of doctors are also like discriminatory too, because they think that because you're a person with a disability, you don't need a certain medical treatment or a service, even though you do, and I just wanted to mention that.
Thank you so much. Yeah, I think this is going to be an enlightening conversation for lots of people. I did make a note of the housekeeping in particular. And like I said, we do send a transcript of this discussion with questions and comments that have been brought in by you. And we do send it out to a list of government officials and healthcare officials that can instigate real change to make sure that you feel heard. So thank you,
Also,
Amelia, for sharing.
I can't get funding to get a helper to do exercise too, like to go swimming or to go to the gym. It's really difficult for me to do it by myself. And because I can't go by myself, I feel like I'm not getting proper exercise and stuff as well, which is also like a preventative thing for health problems. I forgot to mention that previously.
Absolutely. Good points. Okay, I'm trying to make sure that I can see whose hand up is up first. So I see two participants have raised. I see Patricia. Patricia, would you like to add or comment?
Hello, yes, thank you. I wanted to speak further to what Amelia was saying. So I have a genetic condition called Ehlers-Danlos hypermobility type. And so similarly, I've had referrals declined because the specialists do not see Ehlers-Danlos patients. And I find that very shocking and wrong, because I feel that no matter what your health issue, you should be able to access a physician. So like if I were to compare it to, say, cancer, if someone was referred to a cancer clinic and the doctor there said, well, we don't deal with bone cancer, we only deal with breast cancer, it would be, people would be up in arms of it. Whereas with things like Ehlers-Danlos, I've been referred to a cardiologist, and then the cardiologist says, no, sorry, I don't take Ehlers-Danlos patients. And then I've been referred to a rheumatologist and told, sorry, I don't deal with Ehlers-Danlos patients. And so then I just get referred back to my GP, because there is no one in BC who specializes in Ehlers-Danlos. The only thing I've been able to access is going to medical genetics, where they rule out Marfan and then refer you back to your GP. So I just wanted to sort of reiterate what Amelia was saying, that if you have something that's not as common, there doesn't seem to be much. And then there's also this lack of diagnostics, where even with Ehlers-Danlos, it's like, is it even rare? Or are people just not able to get testing? So, there's that whole piece too. I just wanted to mention that.
Those are great points, Patricia. Do any panelists want to jump in and speak to this discrimination? I know we sort of addressed some of the gaps in those barriers before. We do have a dynamic MG with their hand up.
Yeah, that's me, Monica. Hi. Yes, thank you. So I've had the worst experience in my life in an ICU this past summer. I'll go, it's a little bit of a long drawn out story, but I'll give you the closed version of it. Basically, my lungs collapsed from a pneumonia, and I was on a high-powered BiPAP machine in the hospital, and the doctors, the one ICU doctor showed me my lungs, and of course they're differently shaped. I have osteogenesis imperfecta as well, like Amelia, and he basically told me that he wasn't sure what was going to be the future because he didn't know if my lungs were going to reopen again, and how far do I want to go? At that point, he already convinced me not to have a do not resuscitate order. And at the time I said yes, because I was so freaked out. And the way he described it literally was, we have to push really hard on your chest and you'll break your ribs and, there might be nothing left. In other words, there might not be any organs left. And that's ridiculous. I talked to a nurse afterwards. My friend that's a nurse. You don't go that deep into the chest cavity wall that you're touching other organs. But yes, your ribs could definitely break, and mine would. That was number one. Number two, he said, I said, well, if I need any more oxygen, well, what about a tracheotomy? Oh, a tracheotomy. I don't even know if you'll survive the tracheotomy. And if you do, you could be in a coma. And if you're in a coma, do you really want your family to make that decision to take you off of life support? And I'm like, well, that doesn't mean I won't survive. I've had surgery before. And then he said to me, well, you'd have to be on a ventilator as well, and then you'd have to live the rest of your life in a care facility. And I'm like, no, you don't. You can live at home with and no, you can't. You need special treatment for that. And you would have to hire special people, nurses for that, and you can't afford that. So he was putting me down left, right, and center. He was using emotional blackmail and manipulation. He basically, the underlying tone was, well, you're here now, but you may have to either live the rest of your life in the hospital or, you might as well just give up. So he was not offering me anything. And it was extremely disturbing. And anybody else I tell the story to, they say the exact same thing. He didn't want you to live. And a respiratory therapist the next day came up to me and said to me, hey, your lungs are really weak. How about you try exercising them? And we went through what that was. And that was even on a different machine so that I can eat during the day. Because when you have a BiPAP mask, it covers your entire nose and mouth. So I said, okay, sure. Hours later, he basically came and said, oh, why don't you try this little exercise? Or just at least 10 minutes a day, only if you can. Not encouraging whatsoever. And he went away for 5-6 weeks. He comes back. He never once, by now, I am in the recovery ward. I'm no longer in the ICU. I don't have the BiPAP mask on. I don't have the high flow mask on, just a regular nasal mask. Do you think he came to me and said, congratulations? And one of the major reasons why my lungs collapsed, because when I went in the hospital, they weren't collapsed. I just had pneumonia. They let me sleep for 2 weeks, practically. They made me lie down most of the time. Instead of me exercising, trying to do as much as I can. No, they were doing passive restraint, giving me Ativan day and night. So I was barely moving. I ended up having high blood pressure, edema. I was in really bad shape. But it wasn't, if it wasn't for my tenacity, and my sister being my advocate, my family being my advocate, and thank God, my God giving me strength, that's for sure, I might not even be here today. I could have died. And it was, he didn't want me to have physiotherapy, what's called respiratory therapy. Well, no, we can't do that because your bones could break. I'm like, I know how much my body can handle. They did it once. And I said, come on, I need more of that. I need it every day. No, we can't risk it. My own physiotherapist, I have more than one, and they were willing to come in and help me. But the hospital said no. I had to beg them to let me get my caregivers back because they said, oh, we can't pick you up. We can't pick you up. You have to go in a sling. But that sling was dangerous the way it was. They had no concept of handle a person with osteogenesis imperfecta. Yes, I'm fragile and I break easily, but there's a way you can handle me and I don't break. So this to me was outrageous, and I'm in the process. I'm writing down all my feelings and perceptions and like everything that took place, and then I have to take a step back, and I'm going to write a letter to the ministry, to the Minister of Health, and all these people, because this needs to change. So someone has said to me, nothing's going to happen, Monica. You write a letter to the newspaper, nothing will happen. But if we don't start speaking out, nothing is going to happen. You're absolutely right. We all need to start speaking out, and we all need to tell people what's happening to us, because this should never have happened, ever.
Yeah.
And to Amelia, I just want to say, I do have a doctor specifically for osteogenesis imperfecta, and I'm happy to share that with you offline. That's not a problem.
Wonderful.
There are a few and far between, but there are some out there. So anyway, for what it's worth, I say we need to be our self-advocates. And if you ever go in the hospital, you need to bring somebody with you, because time and time again, they're asking me, oh, you live alone? How do you do that? Like, they didn't know about the Choices for Support and Independent Living program. And I even, like, the doctor was trying to convince me that my lungs are going to get worse and I'll probably die from that anyway at some point. But you don't know that. Yes, I know there are papers on this disease and most people do die from the lung issue. However, not everyone does. And I even met a woman online on Facebook who had a pneumonia, who was on the BiPAP machine in the hospital, and her lungs came back. And I asked her, well, did they give you medication? What happened? She said, no, just time. She even gave me the doctor's name and how to contact him. Do you think anybody in the hospital believed me? Oh, no, it's a different situation. And when my lungs were starting to get better, some of the therapists said, oh, well, you remember what the doctor said? Just because it's a little bit improvement now doesn't mean it's going to be later.
Right.
I'm passionate about it because it's happening to me, it's happening to other people. And I'm sorry, I'm going to have to bring it up. But this is why people are choosing to end their lives, because they don't have access to medical care, because their doctors don't believe in them, because they think we're just using up space and we're using up costs. But
and also I want to say too that a lot of these, like, no offense, the people on the panel keep saying they're going to make changes, they're going to make changes. All these health professionals keep saying they're going to make changes, but we don't see any results.
Yeah.
They just speak things and say we're doing this, this, and this. But I've lived 33 years with a lie, and I have not seen very many changes.
Yeah, I'm in my 50s.
Yeah.
Haven't seen much. If anything, it's gotten worse, not better.
Yeah, it's gotten way worse, not
way worse, ever since the pandemic.
Okay, that's an interesting thing to bring up. I so appreciate, first of all, Monica, thank you for sharing that. And I'm so sorry that that was your last experience. Does not sound acceptable in any way, shape, or form, and no one should have to deal with that. So thank you for speaking and being passionate about it, because this is a topic that, affects so many people, and it is important to share our stories. That's why we are hosting discussions like these, so that you can be heard and connected with your community. I think that Sandra, I want to get to you because you had your hand up, but I would like to circle back to some of the changes that have been done in an effort to improve the system. Charmaine, maybe we can talk about that. Sandra? You should be able to unmute yourself. If not, Chloe can help you with that.
Hey,
Awesome.
I echo what Monica said. I know Monica from way back. And also Amelia, I also understand what it's like being misdiagnosed. When you're born with your birth defect, I was born with scoliosis. I was born with some mobility challenges and other. I also want to let you know I'm also Métis. I'm Cree and French. And so the indigenous communities are often lacking services. And we have people that are living in remote communities that are not getting like the support they need, especially those with disabilities. I also want to mention, years ago, the indigenous folks, women especially, like I said, I was born with scoliosis and I had 4 children. When I was pregnant with my very first one, they tried to actually tell me that I couldn't carry children. They wanted me to actually have an abortion and also to be sterilized. And I will tell you, this was in Winnipeg Health Science Center. So the reason why I'm saying this, because it goes all across the board, across North America, especially Canada, and to our Indigenous people. I am glad to say I brought 4 beautiful children. They're all adults, and I'm a grandmother. So I wanted to share that. Also, my biggest thing is I'm currently on EI, on sickness and illness benefits. I had worked, and I also experienced a lot of ableism in the job due to PTSD. And I'm also a survivor of the 60 scoop generation. It would be nice if we could have affordable naturopathic services for some of us that are not a fan of Western medicine or having to go on pain pills, right? And I also have osteoporosis, arthritis, degenerative bone disease. So all of that builds up. And I'm also in my 50s. But these are some of the things I wanted to express my concerns. And I know that we have a huge shortage of physicians in British Columbia. And that is actually causing a lot of service disruption for the patient that do require immediate care. And I also think that the physician needs to be having sensitivity training. That is so crucial. One small piece, I was at Burnaby General Hospital one night, and I have scoliosis, and I was having severe back pains. I was walking, and I have a limp, and you could tell my body's not properly aligned due to my scoliosis. I was walking, and the doctor that was there in the emergency room, and here's this lady with a broken hip mocking how I walked. And I was just like defloored by that. I was like, what is going on? I didn't say anything. Everybody stared at me, and I'm kind of like, I just kept quiet. I was just appalled by that. And that's an example of ignorance in the medical system. Doesn't matter, disabled, whether you're white, brown, whatever. Everybody is entitled to proper, adequate, humane health care. And you wonder why our people, the Indigenous folks, don't like going to emergency because of this kind of stigma and having to deal with any kind of racism. Thank you. That's all I have to say.
Thank you so much, Sandra, for sharing that. Do any panelists want to speak to that? We also had a comment and question from Asifa in the chat speaking to this, saying Canada is failing at its commitment to the United Nations Convention on the Rights of Persons with Disabilities. We need more advocacy at a political and legal space. Self-advocacy is important, but doesn't carry enough weight. We have systemic discrimination towards people with disabilities. What work are we doing or aware of to hold government to account and meet obligations Where is the Canadian Human Rights Commission on this? It's only getting worse as the healthcare system is being under-resourced. This does kind of circle back to what Amelia and Monica were talking about before, having felt like things have gotten worse since the pandemic. Charmaine, I don't know if you're the one to start this off, but maybe between you and Heather and some of the other panelists, can we talk about some of the changes that are underway or have come into effect in the last couple of years?
I'd like to hear from Joanne. Joanne had her hand up and wanted to speak.
Okay, awesome.
Thanks, Charmaine. Monica, first I want to say I'm so sorry to hear what you went through. That was absolutely horrific and very much speaks to the prejudice that's happening still to this day. And what we just discussed a few moments ago about the absolute need to get better education in the training of our physicians, healthcare providers, nurses, whomever it may be. I do want to pick up on something that Amelia talked about having funding for whether it be helping clean someone's home for better healthcare, having someone help you get to the gym to exercise, absolutely speaks to better healthcare. And also, Sandra, you mentioned about naturopathic services. All of them, I believe, in some way or another, hopefully they can be funded in some way. Again, we have to advocate for ourselves or have someone advocate for you when you're in a hospital system because of the reasons that Monica described. And I hate to say it, but so much of the onus is put on us. And part of why I practice and do what I do for a living is prevention, prevention, prevention. So whether it's kind of naturopathic, dealing or helping to prevent osteoporosis from getting worse. When I saw the early research of spinal cord injury and what it meant long-term living with and the secondary health complications that I was going to deal with and my community, my demographic was going to deal with getting older, and realizing that there was not a nutritional component to help maintain your health. That's why I went back to school and started to practice in what I do. Prevention is key. Just to put it out there as a stat, people with spinal cord injuries, we on average live with 7 additional healthcare complications every year on top of our spinal cord injury. It can be extremely expensive. And once you're hospitalized, your health is going to deteriorate even more. And so for me, prevention is key. So whether that means exercise, it means getting your house cleaned or having someone help you, or eating well, all of these things are absolutely critical. And I understand there is a financial component to this, and not everybody can, say, hire a naturopath. So often it's not even including supplements in your diet. It's sometimes taking certain things away that can contribute to deterioration of your overall health. So prevention is absolutely key. So much of what we're dealing with, it is up to us to practice that. Unfortunately, the nutritionists aren't covered here. I do a lot of workshops to try and get the information out there to people. It really is the onus on us to help prevent a lot of what we're going to face in the future. So I just want to speak. I just wanted to support what Amelia and Sandra said about prevention and having people help you. I know right here in Ontario, we don't have that kind of funding to help people. I don't know what the case is out there in BC. So as much as you can prevent things, and this is what I preach to all of my clients, and especially my young clients, because they don't realize what they're going to be facing in their 40s, 50s, and 60s with long-term living with a disability, and that there is a faster acceleration of aging and arthritis and all the things that go with it, osteoporosis and fractures. So prevention, as much as you can possibly practice, is absolutely key. And if we can there's a way to get these things funded, fantastic. So.
Thank you, Joanne, for sharing
Thanks.
that. Yeah, I think that seems to be the overall consensus: prevention, get ahead of it. Charmaine, do you want to go back to you?
Sure, yeah, I want to start by also thanking Monica and Amelia and Sandra. Thank you for sharing your stories. And it's unacceptable. It's unacceptable. And I can guarantee that everybody on this call has probably experienced some form of unacceptable healthcare. And I'm not going to sit here and list off a bunch of programs and policies that are being worked on change. I'm not going to sit here and tell you about all kinds of great work and projects that help that's happening to help things in the future in the system. because we all want to experience healthcare better right now, and myself included. I just had a very negative healthcare interaction yesterday, so I hear you. We all want it to be improved, and it can mean life and death. And Monica's example, especially, is a very clear one around that. And Sandra, jealous of the adorable puppy you've just brought into your lap, but I also wanted to identify as well that we are also trying to navigate all of this while being very conscious of doing things with Indigenous cultural safety and humility is top of mind. That is also a huge focus right now in the province since the In Plain Sight review came out. If you're not familiar with the In Plain Sight report, maybe Emily, you could share that link as well. And that's work that at HQBC, we're also very much working on pushing the In Plain Sight recommendations forward, as well as the ones that connect to the Truth and Reconciliation report. It's really important in my opinion, but also in the eyes of where I work, it's really important that stories are shared, because if we don't know what's going on and what's not working, we can't push this forward and these changes forward. The stories are super important. Doing so in a way that we're willing to work with others, though, is also going to be key, which is, again, what we do at the Patient Voices Network. We need to hear from folks receiving care and working alongside the system. And just to give that concrete example, like Amelia, your experience, that would be something that would be really phenomenal to be heard at the folks who do the education around patient engagement in the medical imaging program at CMOSIN or BCIT, having you be a speaker to speak to these experiences and teach our future healthcare providers about these things at the onset before they even step into the system. They know about these things and they understand all the bias they have before they even actually start to practice in healthcare. So that's something that I just want to reiterate how important your stories are and your voices and speaking up. And I also want to identify that it's not just up to you, that families and friends and caregivers are absolutely key components for changing healthcare as we go forward and for being part of those patient voices. I mentioned I have a parent with disabilities, and I am so frequently their advocate and quite literally physically taking them to get their healthcare. It's very important. And I'll add to that as well as chosen family. I have a lot of chosen family as well. That those are absolutely key folks to be having them speak up as well, and having them be those advocates for change as well are very important. So thank you again, everyone, especially for sharing your stories. It takes courage and strength to be able to share that, because you have to live with it every day. And really grateful to hear that. Back to you, Emily.
Thank you for that, Charmaine. Yeah, stories, experiences being shared, super important, so that, people are reminded that this is not changing, and as some of you have expressed, getting worse. So thank you again for being brave and sharing. I would like to talk a bit about provincial and government support, because it did come up a lot in our survey. So from our survey alone, 58% of respondents have made a claim to the Government of Canada or provincial government or an employer and received disability benefits. 32% had not, and 5% don't know how to. So I know, Heather, this is sort of your area of expertise. If someone was to call you and ask how to apply for disability benefits, I know that it's probably circumstantial to everybody, but I would love to hear a little bit about what you think some of the barriers are for people to apply for disability benefits, and some areas that can be approved there as well.
Sure, I'm happy to answer this one. So the answer is it depends, because there are such strict eligibility rules for each program. So one of the first questions I ask people is, okay, what income, if any, do you have per month, and what income does your household have? because unfortunately, some of our programs like provincial disability are based on family or household income. So if you're partnered with somebody who is making an income, then that absolutely affects the disabled person's eligibility. It's not right, but that is the current rule. I also ask about people's work history, so how much they've worked, to try and suss out whether CPP disability or provincial disability is the better option. The reality is, if people have any kind of need for medical equipment or supplies, PWD is almost always the better option if they qualify, even though they might get a little bit less per month. They would get at least some coverage for basic medical equipment. It's not going to be the medical equipment a person really needs or wants, but it is that basic level of equipment. So those are the conversations that we would have. The biggest barrier is that the system is complex. I work in the system, I understand the programs and the rules, and I still have to check the eligibility requirements because they're complicated. And I don't think we should expect everybody to come into this with a huge amount of knowledge. People are often thrown into disability quite suddenly and don't have the background in knowing this information. So they have to have a crash course in how to navigate the medical system, how to navigate the social services systems, while also dealing with a new diagnosis. All of that is quite emotionally tiring. And consequently, I think people, well, they're too tired, they're too busy dealing with other things, and it can be quite difficult to try and figure out the best programs to apply to. So that's where I would suggest always reach out and find somebody who does know the answers to help navigate through that, because it's a lot to be dealing with. And if somebody's been through it before, they can probably point people in the right direction rather than having to start from scratch every time.
Yes, I think that asking for help is pretty imperative if dealing with a new injury as well, or at any point. I'm just going to repost the SCIBC info line in the chat again for everybody to have. Thank you, Heather. Does anybody, yeah,
If I could just jump in quickly and say that we assume, or the public assumes, that our system covers people with disabilities for everything that's required. Obviously, the people on this call know that that's not the case. But when people are newly injured or newly into this world, they are often shocked at what isn't covered. So things like housekeeping is a huge one for people's health, and it simply hasn't been covered for many years. So it's a real shock to people, and that's part of the learning experience, is figuring out just how problematic our system is.
Yeah, very good points. Housekeeping is something I've written down and underlined here. Sandra, do you want to add to that? You're just muted there. Happens at
sorry
least
about that. Just what you're saying there, Heather. An example I have is I'm on medical service only. Prior to that, I was working for 9 years. I no longer am able to work due to my chronic pain and all of these other disabilities I have. So you were talking about how some coverages are not, well, how some medical stuff are not covered. I, for one, want to say, like, for osteoporosis, one of the medication I was on, prior to, I did have medical benefits through my work, but since I'm no longer employed with them, I find that the medication I have to take for every 3 months is like $30-some. So like for people that also have mobility issues due to like scoliosis and arthritis, not walking poles, canes are not covered. And these are just some of the things that are essential for us to have. Currently, I'm trying to ask my physician to see if there's any other medication that is covered for osteoporosis, because otherwise, and I'm not status, so otherwise I have to pay out of my own pocket for my medication every 3 months, whereas my work benefit, I only have to pay $12 prior to not getting any more benefits. That's all I have to say.
Thank you for sharing that, Sandra. It's good that you're bringing these up to your practitioners as well. I don't know, Vanessa, if you wanted to talk at all to sort of, as an individual healthcare practitioner from your lens, advocating with the larger insurance companies when things don't go through benefits?
That's a great question. So for context, the folks that I usually work with on my caseload typically have insurance funding from either like a workers' compensation board, or it could be ICBC, which is our motor insurance coverage in BC. Other options for insurance could be private insurance, or sometimes out of pocket pay, or long-term disability. So a barrier that I often face working in the private sector is a lot of these times the adjusters and insurance companies don't come with the same healthcare lens. So their understanding of certain diagnoses, certain needs that clients have, or any even simple things, even just like equipment, it's not always, we as a clinician, we are sitting here having to walk them through why individuals need these pieces of equipment or needs or services. A lot of times I find that the adjusters are quite surprised at how much these things cost, and it is it's part of my role as the clinician to have to provide that education to the adjusters. One thing that I know that my leadership at Tall Tree Health, they do meet with quality assurance. I don't know if they're quality assurance departments at different funders to talk about a lot of the issues that we bring up with that we find in our practice, to help so that the insurance companies are able to make policy changes on their end, as well as educate their employees on how to better manage these claims. My day-to-day practice is a lot of times forming really good relationships with these adjusters and making sure that they understand what my clients are going through. Because I find that as a clinician, I am actually seeing these clients in person and actually being able to hear their stories. The adjusters are not always getting that face-to-face interaction with them. So a lot of their needs are not being translated. They may be basing their decisions off assumptions or just reports that are being provided to them. And that's not always the best depiction of what's actually going on for this person. So in the private sector, it can be a bit tricky sometimes. And I think just going back to something that I think Asifa mentioned, like what are we doing to help kind of advocate for these processes to be a little bit better? Well, I think we can do more. I think being part of this conversation has really opened up my eyes that I think there's a lot more that can be done. I think the first thing that can be done is, of course, bringing up these issues to the people that can make the changes at these insurance companies or on government levels. But I think a good question to ask myself is, what can be done after that? How can we progress that even more?
Thank you so much, Vanessa, for speaking to that. And I think, yeah, us all walking away from here asking ourselves, how can we, advocate more and make our voices heard. Ruth, you had a question a while back. Apologies for just getting to now. Can anyone speak to how invisible disabilities are being addressed in the healthcare system? Maybe we could go to Pascal on this, working in pathways with mental health.
Yeah, obviously, like members here at the clubhouse have varying disabilities, mental health concerns, but also physical as well. For those primarily with a mental health diagnosis or mental illness, it's not always apparent, obviously. And so a lot of actually what the clubhouse does in our model is try to break down all those barriers, whether it's the healthcare system, just attaining employment, like just any area of life, essentially, making sure that the people that come into our clubhouse, we can reduce or eliminate some of those barriers to whatever they're trying to access. That might even just look like a staff going alongside someone to a doctor's appointment, or if we're not the advocate, just even being in the room with them to have someone else listening in and be that, second person there to be aware of what's taking place. And because even just some of the people I'm supporting, just landlord issues are a big problem for us, where they don't always comprehend. They see their person that has moved into the apartment and they just make assumptions like, oh, well, I don't see anything wrong with you. And, like, why do you need supports? And why do you need me to be gentle with you around this issue? Or like, why do you need this? So then obviously stepping in to let them know, what the scenario is, and how can we make this work so that the person is feeling safe and secure in their home, and they're having their needs met. And just something that comes to mind is people who have experiences with PTSD, and then someone is hammering underneath their room. It's something that can definitely affect the person and their overall well-being, but at a glance you wouldn't know that they're maybe struggling with that. So I have less hands-on experience with the medical side of things in terms of, being at an organization that's non-clinical, but we do support the individuals coming here with their medical needs, and trying to go with them to appointments and to the hospital when needed, and seeing where we can advocate for them, even just sitting alongside them for a phone call if that's too overwhelming for them and they want someone to be there to, because it can be quite daunting. Like, there's often a number of hurdles you have to go through and people you have to talk to, and sometimes it's automated calls or you have to go to a website. So if that's something that I feel I can help them with and eliminate some of those barriers and assist them to get the resources they need, then that's kind of what my role looks like.
Thank you for sharing that. Yeah, Pathways is doing some really important work. I have shared that website in the chat as well. Mental health is a big part of I think this community and the community as a whole. Patricia, you have your hand up. Would you like to say something?
Yes, sorry, I was stuck on mute there for a moment. I just wanted to also mention with the invisible disabilities, how, and I don't mean to say anything about, about mental illness, like it's important, it's its own issue. Sometimes there's intersectionality. I have mild PTSD, driving specific, from surviving a head-on collision in 2015. That's actually how I found out I had Ehlers-Danlos. And so again, it's considered mild. It is very specific to driving, and driving in adverse weather in the dark. So on my chart, it says I have PTSD. And so I just wanted to take this opportunity to talk about diagnostic overshadowing, because all it says on my chart is PTSD. And so I find that the conclusions that some physicians will jump to when they see that is quite shocking. But for me, I also have invisible disabilities of Ehlers-Danlos, dysautonomia. I have long COVID. Like before I caught COVID, I was working full time, volunteering, white collar professional, all that good stuff. And so I find that I have other biological invisible disabilities, and there's a biopsychosocial model that is implemented a lot. But sometimes the bio part gets sort of dropped, and then you get into psychosocial world where no matter what's wrong with you, the attitude is that it must be psychosomatic. I've had doctors who have never met me before say, oh, you must have anxiety. Oh, you must have a hypochondria. You must have somatic symptom disorder. You must have adjustment disorder. Despite the fact that I have like at least 5 different assessments showing like, no, I don't. The only mental health issue is the driving specific mild PTSD. And then, you know, this long COVID, like sometimes neurological muscle twitches and migraines and stuff. So I just wanted to speak to it because if you try to access mental health support, inevitably it is intertwined with addiction. And that is a need in society. There is an addiction issue that's, you know, everyone knows about it. I think it is something that care practitioners can get tunnel vision about. And so if you're a person with an invisible disability that does not involve substance use, or if you have a mental health issue that is mild, but it's in your chart, but again, not intertwined with substance abuse, there's very, very little support available. Because as I say, like even all the hospitals, they always say mental health and addictions. They've combined the programming. And so I just wanted to speak to it because it leaves those of us who do not use substances with really nothing, nothing at all. And I know in my case, I don't want to be further entrenched in stigma. And I don't want anything to do with substance abuse programming because it's not relevant to me. Like, not a judgment call, nothing to do with, you know, like, it's important, but it's not something that's relevant for me in my life. So sorry to ramble, but I just wanted to put it out there because people like me fall through the cracks, and then we just have to pay for our own mental health and wellness support elsewhere. But for people who can't afford that, they don't really get anything.
Yeah, absolutely. Some really interesting points brought up there, Patricia, that I'm sure a lot of people were unaware of, myself included. So thank you for telling us about your experience, because I'm sure you're not alone in it. And there are a lot of gaps. Ryan, I see that you have your hand up. Would you like to speak?
Yeah, so I'm a clinical counselor for the last 6 months, and I specialize in physical disability counseling. And I've noticed that the access for people with disability to mental health is it's not good at all. It's very hard to get it, and people get this idea that mental health and physical health is separate. But if we have good mental health service for people with disabilities, a lot of the health things that they have could be prevented, because a lot of mental health stress from doctors are not getting support for discrimination really is a big impact with people with physical disabilities. And I just find that getting access, or even counselors will actually refuse clients with disabilities, so which is just shocking. So if you got all this trauma from being in the ICU, then you can't get mental health treatment, then the stress of PTSD or whatever mental health issues you have compound your physical health, which is just and then there's also the poverty. People can't afford a counselor $150, or some counselor charging. It's very frustrating to see that in the mental health field, they're supposed to be trained to be not discriminatory, but they very much are. They'll tell you it's in your head, or it's adjustment disorder. It's just yeah, I'm there's very few people that specialize in physical disability in counseling in Canada. There's probably maybe 5 people, including myself, which is just frustrating. I can't make the changes by myself. I can only advocate for one client at a time to help them fight the medical system, but there's not enough people like me in mental health to make changes, which is frustrating.
Absolutely. Those are great points. Ryan, Charmaine, I see your hand up.
Yeah, thank you so much for sharing about that, Ryan, and Patricia as well, from your experience. It's very poignant, what you have to say around these mental health aspects around PTSD, and Ryan, you're also a clinician as well. Have such a unique lens as also, being a counselor. The pieces around mental health are absolutely key to health, period. They are absolutely connected and intertwined. I know that in HQBC's work, it is a huge body of work that we've been asked from the Ministry of Health to focus on. So our two big key areas that we're focusing now on going forward are Indigenous cultural safety and humility, and supporting our Indigenous communities across the province in culturally safe ways, and then the mental health and substance use, but the mental health piece is a huge part of the direction that the province is going to be focusing on and is now focusing on. I wish it could happen faster, that's for sure. None of it happens fast enough. And this question around this point around access to is really poignant. That Ryan mentioned around even being able to access a counselor in general, but access one that has knowledge and understanding around disabilities is very poignant to hear, and something I hadn't considered before. So that's great learning for me as well, personally, is to be able to be considering these pieces. So I just wanted to iterate that these are aspects that are absolutely at the top of the kind of workload and agenda, if you want to put it that way, across all of the province's programs. It's and I'm very glad to see that this is a focus, because to me, one of the many things that came out of COVID was a recognition and understanding of the absolute significance and importance of our mental health on us being able to function and be who we are. COVID unfortunately shined a light on that for everyone. Anyways, I'll stop there. I'm going to see if Patricia has her hand up. And if you do hear any background noise, I apologize. If it sounds like a crying baby, it's just my very needy cat.
Yeah, I don't want to, I should say, I guess a little trigger warning, but I just wanted to quickly say, two quick, little scenarios. Three, I'll make them as quickly as possible. So one, my late husband had glioblastoma. He was placed on steroids for the inflammation in his brain. He developed steroid mania, and he was Section 7 under the Mental Health Act. And he was palliative cancer patient. And I tried to explain to the doctors at the hospital, look, he has steroid mania. Look at his healthcare plan, take him off dexamethasone, and he will calm right down. They wouldn't listen to me. They continued administering dexamethasone, and then he would have his mania, and they would inject him with Haldol and put him in 4-point restraints in the psych ward. It took 10 days for me to successfully get him off of the dex so that he would be calm enough to be discharged so he could go and die in the palliative ward, like with dignity. So that's one. Two is a friend of a friend. She was having a mental health crisis in Vancouver, tried to jump off the BC ferries. So she was Section 7 under the Mental Health Act. And while she was in hospital, she lost her home. She was evicted because she was not at home to pay her rent. So she was discharged from the hospital homeless, and then ended up dying from suicide a few months later in homelessness. And then the third situation was with my late brother-in-law, who was grieving the loss of my husband, his brother, and also his father from cancer, and went to voluntarily to the mental health ward at one of the hospitals around here. And he was let off on a day pass where he died by suicide from jumping off the Lionsgate Bridge. And when my mother-in-law asked the psychiatrist at the hospital, why did you let him out on a day pass? The psychiatrist replied, oh, I didn't know he was depressed. And she said, well, he was brought here by the police after having an episode, and he was supposed to be in your care for a month. Why was he out by himself on a day pass? And the psychiatrist's response was, oh, well, I had no idea he was depressed. What do you want me to do about it? So, I don't mean to be saying triggering awful things, but like this is the reaction. This is what I'm seeing happening, and it's like since the pandemic. It's all since the pandemic. So I just wanted it on record somewhere because nothing happens, right? Like there's no recourse. So I'm sorry to be saying these not very happy topics, but I just wanted to put it out there.
Thank you for sharing, Patricia. And Monica has their hand up about this as well. And hopefully in the chat earlier, there was sort of some links and suggestions on how to file complaints with healthcare. But I'm sure in general, that just sounds exhausting. And I'm very sorry that you had to deal with that. Monica?
Yeah, I was just going to say that this is part of the problem too, that doctors don't believe us. And they don't believe, like, oh, who knows the husband or wife better than the spouse? Most of the time. I'm not saying that that's all the time, but generally speaking, you're over 90%. And the same goes for me too. And as a daughter, when my mother was in care, and we were, as she was ending the end of her life, you know, when one doctor came in and said, so what are we doing for her? Just providing comfort because she had a disability as well as she's aging. And I'm like, well, no, we want her to live, thanks. And she has a disability and she had cancer and she was going through cancer treatment. And then this one doctor says, oh, are we just providing comfort? I said, no, we want her to live as long as possible. Oh, I see your sister's a doctor. I'll wait till she is back from wherever she is. So she was completely dismissing me. What do I know? I'm a person with a disability. And so this is very, very frustrating, and that I am dismissed because I'm a woman. Well, I don't even think it's because I'm a woman. Just because I have a disability, I don't know how I want my mother to be cared for or know that what she wants to be cared for. We have to wait till my sister comes back from a conference because she's a doctor, because I'm not valid. So I find this is horribly upsetting that we're not even being validated.
Absolutely. Absolutely. So much. I do want to go back to mental health for a moment here, just in case there are any resources. I know, Joanne, you have a prevention and resource list as well, that any of the panelists wanted to mention, same with Pascal and Pathways, how someone might go about finding mental health support, and if there is any funding available for that outside of the regular system that we know about.
I'll jump in just with some very basic information. So I don't know if this is the stuff that folks already know, but as far as access to a physician, I myself no longer have a family physician due to a sudden retirement. And so I've registered with what's called the Health Connect registry. So this is the new registration system that the province launched fairly recently. So once you're on the Health Connect registry, it's basically a wait list for access to a physician. So like I said, I myself am on that wait list. Obviously, once you have access to a primary care physician, it opens up obviously access to potentially other things. So I just wanted to throw that into the chat. Some folks don't know about that registry. And also from a very basic information standpoint, 811 is that general nurses line that they are absolutely required to follow up on providing you with resources and information. So on any phone, you can dial 811 and they are supposed to connect you to resources, including for mental health. So I just wanted to say that one out loud as well. Thanks, Emily. I was just gonna type in 811. I also tried to look up a more detailed bit of information about exactly what 811 can offer, but it lists really kind of in general referrals of information. So, and it's one of those things that I've found, I've called a couple different times myself, and you get a different, usually a different nurse practitioner on the phone every time. So, so you might have a different experience depending on who you talk to. So I've personally had some really great experiences talking to them as well. So from a mental health standpoint, I wanted to put that out, as well as there is and I'm sorry, Emily, I don't have it handy, the BC crisis line, same thing. They are required to follow up as well with you. If you reach out to the crisis line with mental health support and services, they are required to follow up. And there's no charge to reaching out. So thank you, Crisis Center, bc.ca. As far as accessibility with them, I do know that they offer like a text option as well. So you don't have to call and you don't have to be in person. I know they offer a text option that might be a bit more accessible for some folks. But that's the limit of my own knowledge. It's also, you know, a very challenging, it's a very challenging issue. And I think it impacts all of us in some way. And Patricia, thank you for sharing as well your stories. I as well this past year have been impacted by suicide several times. So I absolutely, I'm someone who, like I said, everyone else on the call too, we've all had those experiences that show us how we don't want it to go. It's not the patient and family-centered care we want to see and have. So, so yeah, thank you for sharing that. And it's unfortunate to say that it's relatable to many, I'm sure, on the call. Vanessa, over to you. I see your hand up as well.
Thank you. I just wanted to keep my hand up here just because I had a couple resources that myself and my colleague Cassie have put together. So Cassie's located on Vancouver Island. So she had a couple different Vancouver Island-based mental health services that are GP referral based. So you just need a family doctor to help you put a referral in. So I will send those links. I'll put those links into the chat for everyone as well. On the mainland, it's not a free service, but there is a private clinic out of Vancouver called Willow Tree Counseling, and every year they put out a really wonderful document on reduced cost counseling clinics across all over the mainland, and it usually runs on a sliding scale based on your income. So I'll also be including that as well. Some psychologists, clinical counselors, and other service providers also may offer a sliding scale. I don't know which one those are, but usually what we recommend for our clients who live in more rural areas where we're not sure or not familiar with what resources we have, we always recommend that we give them a call and see what they're able to offer. We always try to advocate with our clients to see what types of reduced costs services are out there. So I just wanted to put that out there for everyone. I know it's pretty few and far between.
No, thanks for that, Vanessa. Yeah, Jess.
Can I jump in?
Yeah,
Sorry.
Go ahead, Joanne.
Okay, since we're kind of giving some resources here, I just wanted to jump in. I've seen in some of the chats a couple of inquiries about workshops that I might be hosting. I actually don't have any coming up. I'm taking a bit of an extended period of time off from doing some workshops. I'm going to be away for an extended period. But I used to do a lot of workshops with SCI BC, and I'm not sure if they're online, if those have been recorded and online. So maybe you can go to the SCIBC site and check those out. If not, I know SCIBC still does a lot of nutritional workshops with other nutritionists and chefs out there, like Cooking with Corey. So check SCIBC. Again, you guys do incredible work out there, incredibly progressive. You're the best kind of SCI organization out there in terms of the services you're providing all of your people. Other just podcasts. I learn a lot from health podcasts. The Ultimate Health Podcast has been on for years. They have a wealth of information, and people with disabilities, because of stress, because of medications that we may be on, we tend to have compromised immune function. So even if you go to the Ultimate Health Podcast and look at, ways to support your immune function, we also tend to deal with a lot of arthritis. So there are specifics, podcasts looking at arthritis and supporting bone health, looking at osteoporosis. I would also suggest, if you like a more of a scientific approach to healthcare, the Huberman Lab is a podcast. They are phenomenal. The research this individual does, again, on specific health topics, scroll through for items that you might be interested in to adjust your own personal health complication or condition. Very sciencey, great nuggets of information on there. So I also, if you have a spinal cord injury and you happen to be on here, I wrote a book 12 or 13 years ago with another nutritionist specific to health complications for people with spinal cord injuries. And it's available in PDF form on eatwelllivewell.sci.com. You can get the PDF there. So there's some resources for you there as well.
Awesome. Thank you for listing those off. I've been trying to keep up and put them in the chats. Those are actually two of my favorite podcasts. I would say if you're gearing up for a Huberman Lab, make sure you have 2 to 3 hours or listen to them over the course of a couple of days. It's a lot of information. But that's great. Yeah, and Pascal, do you want to talk at all about helping people find mental health support? Is that something that Pathways is about? Yes?
Yeah, so just in general, if people want to reach out, I can provide my email address here. They can contact me directly and I can help them navigate specifically the resource they're looking for. I'll just share in the chat just some of the basic ones we put on our webpage. Make sure this is to everybody here. That's our website. So you're welcome to explore that for some resources. But yeah, I'm happy to help tailor specific needs that you're looking for if you want to reach out to me specifically so we can look at finding you a mental health clinician or a group or a peer support program or whatever it is that you're looking for.
That's fantastic. I'm just going to toss your email in the chat if that's all right.
Thank you.
Okay. Great. Did anyone else want to touch on mental health before we move on? We are, it's crazy, but we are getting sort of down to the last 15 minutes here. Okay. Kim, I just want to let you know, Kim posted in the chat, is the purpose of this forum to discuss our concerns and share resources. Is there anything available after this? So just to reiterate, there's a transcript of the chat that will be available. We send a wrap-up email to all attendees. It actually goes out to our mailing list. Resources mentioned here will be added to our website. And the link to this video will also be in that email. So you will be receiving an email and then resources will be on the website. Give us about 2 weeks to do that, which is great. There's a ton of resources popping up in the chat. So thank you to everybody for participating and sharing the wealth of knowledge. Just a couple more questions that were sort of generated by the survey here that we can maybe talk about. Well, mental health and disability come hand in hand, as we've said. Well, we did sort of talk about a little bit of low cost support there. So let's move on from that. Okay, well, something that did come up in the chat and comes up all the time. Jess Adam was saying many of us do not have family doctors. I know that this is a huge issue in BC and our universal healthcare system. Does anyone have any advice in going about how to find a family doctor and sort of starting that process? We have had a website posted in the chat a couple of times, finddrbc.ca. Anything outside of that anyone wants to mention?
I can jump in here. That I hate getting this question because I don't actually have a good answer beyond the resources that have already been mentioned in the chat and by Charmaine. There are virtual options. Obviously, they're not going to replace an in-person visit with a regular family doctor. I'm well aware of that. But as an interim measure, they may provide some of the support that people need. Of course, there's barriers to virtual appointments. So I recognize those, but they may work for some people for some issues. Walk-in clinics are busy, emergency rooms are busy. and I don't necessarily see this one getting better anytime soon. So I just hate getting this question because I don't really have a good answer.
That is fair enough. Yeah, I have had someone bring up before going to, the same walk-in clinic and seeing the same provider that's there so they get to know you, but that's not the same as having somebody that is dedicated to your care.
I think that's a really big issue that the province is trying to address. I think they were just not so long ago putting in new legislation to make it easier for clinicians from other countries and other medical professionals coming into Canada to reduce some of the red tape that they're faced with.
Yeah, and I also find walk-in clinics don't always provide the correct treatments for things because they don't know your past health issues. So it's better to find a general practitioner, nurse practitioner that can know more about your health problem. And then also, I've been lucky because I had cancer previously, so I was recommended to a nurse practitioner through my cancer program. But a lot of people with disabilities don't have that resource, so that can be a problem with finding a general practitioner that knows all about your previous health issues and disability as well.
Good points. Thank you, Amelia. Patricia?
Yes, I just wanted to add, so I found mine, it was back in 2011, so it was a whole other world then. But how I found mine is I was going through a walk-in and I noticed that that walk-in was a training facility for UBC students. And so my walk-in doctor was actually a locum. And so I just asked her, I said, oh, are you going into family medicine? Will you be taking patients? And she was. So I just found by basically like lurking around trying to find locums. And that worked well for me. And then also she's now moved to a clinic in Vancouver and it's called Fraser Street Medical. I'm not promoting them or anything, but they're one of the clinics that takes on complex care patients. So they're aware of the billing codes. So I don't think they're taking new patients right now, but even just being aware that there are billing codes for complex care patients, you can tell a doctor, because then if a GP is considering taking you, but they don't want to like waste all their time, with complex care patients, if they know that they can actually get paid more by seeing you a bit longer and like billing it appropriately, then it will help them not dismiss patients who have complex care as often.
Great knowledge. Awesome. Whatever the clinic that you mentioned, did you maybe want to put in the chat? If that's possible. Awesome. Charmaine?
Yeah, I just wanted to add, thanks for sharing that and that way that that you found a physician. Yes, someone put in the chat as well that that physicians are being asked to pull from the registry and to not kind of do the word of mouth one, so that they are kind of funneled through that one system to make it so that it moves more quickly. So that is correct. That's what I've heard. So registering through that provincial site is supposed to be kind of the new model to move that as quick as possible. Oh, you beat me to it. I was just going to hit paste on the 211.ca website there. Yes, that's another. I'm so glad someone mentioned that. I know I had mentioned 811 previously, which connects you to a registered nurse, but 211 is another new resource, and a lot of what's on the 211 website and phone number, it was actually born out of a lot of what we saw through COVID, folks needing to be connected to other sources and information. So 211 has come out of that as being kind of a home base for a ton of information and resources for folks. So yeah, do lean into that one as well. Thank you as well for mentioning, Heather, the virtual healthcare appointments. I can't believe I didn't think of that right off the bat too, because it has helped me enormously being without a physician right now. And I've had to kind of look up a few different ones, and and see where there's availability. But I've had very quick turnarounds, like same day within 45 minutes, to be able to have sometimes a phone call, doesn't have to be over Zoom, with a physician. So again, not accessible for everyone, and it doesn't help with everything. And of course, with complex health history, it can be challenging. But I have found and heard from others, it's a very helpful way to quickly access virtual care. So I wanted to just give my backing on that as well. Yeah, thank you.
Great. Great. Okay. In closing, we did cover a lot of things today. I just want to say thank you to everybody that shared, because again, it's just really important to share your stories so that, you know, everyone knows what's going on and you're usually not alone in your experience. So thank you for being brave to be the voices for those people that are not here, or people that don't feel comfortable speaking up. Does anyone on the panel want to say anything in closing? We got about 7 minutes.
I think Laura wants to speak.
Okay. Laura, are you able to unmute yourself?
Thanks, Amelia. Yeah, I just wanted to mention that a lot of people don't know that, you know, if you have to do a form or get a form completed, like I'm the senior advisor at Plan Institute on the National Disability Planning Helpline. We get a lot of people, like you said, mentioning they don't have a doctor. So how would they get the disability tax credit form filled out? Because that is the main criteria to get the registered disability savings plan. And the changes did happen within the last year or two to allow a nurse practitioner, and noting that many people in British Columbia and Canada can't get a regular GP or another kind of specialist anymore. So if you can find that nurse practitioner, that might help you to be able to qualify or get some of these really important forms done for tax reductions or other services or programs or funding. And to definitely read through an entire form to see if nurse practitioner is now allowed, or ask in to see if the law has changed on that.
That is great information to have. Thank you, Laura. And I also, Plan Institute is awesome. I posted your link in the chat as well.
Thank you.
Okay, Joanne, Vanessa, Pascal, Heather, Charmaine, thank you so much for being a part of this discussion. Again, a transcript of the chat, also a transcript of the entire discussion will be sent out in an email, as well as included on a resource page on our website, ConnecTra.org, in about 2 weeks' time. Give us a little bit of time to get it up there. Also, Chloe is going to post the panelists' email addresses. There you go, in the chat. Vanessa, we didn't have yours. If you'd like to post it, you can. If not, no worries. If anyone has any follow-up questions or comments, ideas for other accessible community forums, or just things they want to add, you can email me directly, echambers@connectra.org. It's also in the chat there. And Vanessa just added hers. Thank you for attending. The Disability Foundation and ConnecTra are both nonprofit charitable organizations. So please check out our ways you can support us so we can keep having these events. And also ConnecTra.org for events that we have coming up. Thanks so much. This was really eye-opening. And
Thank you, everyone.
Yeah, and I promise to broach the subject of ASL and make sure we have that covered at our next online meeting as well.
Thank you. Have a good day, everybody.
Thanks, Sandra.
Thank you.
Thank you, everyone.
Lots of tough conversations, everyone. Please take care of yourselves. Take good self-care the rest of the day after tough chats. So appreciate it.
Thanks, everyone. Appreciate the reports.
Nice to see you, Kim. Thank you.
Bye.
Perfect. Beautiful. Thanks, Graham. Live stream can stop too.
Yeah.
I'm just getting on that right now.
Great. And Chloe copied the chat.